is Jenny. I will be demonstrating an NG tube insertion. I am outside my patient's room looking at their orders, and my patient is Jennifer Doe, date of birth 11/5/1975. She has no known drug allergies, and she has a new order placed for an NG insertion. She has a bowel obstruction, and that is the purpose of the NG tube. So I'm going to go ahead and I'm going to prepare my supplies. And I want to make sure that I have the right size NG tube. I have the right tube here. I have a Salem Sump NG tube. I have a 60 cc syringe. I have a towel or Chuck's pad, measuring tape, some tape, a prep pad, a pen light or flashlight, tongue depressor, some lubricant, some gloves, maybe some water if my patient isn't NPO and is able to swallow. Maybe an emesis basin, some tissues, and I have already checked my suction beforehand, make sure it's working properly. Another thing with the NG tube is you might need a stylet in place for insertion, but in this case I do not need it for my procedure. And now that I have all of my supplies ready, I'm going to go ahead and enter my patient's room. Privacy. I'll wash my hands. Hi Jennifer, my name is Jenny. I will be your student nurse today. Can I have you please tell me your full name and date of birth? And she says Jennifer Doe, 11/5/1975, and her armband matches up. And Jennifer, can you tell me if you have any allergies? She says no, she does not have any allergies. How about any sensitivities to any cleansing agents? She says no, she does not have any sensitivities. Okay. Jennifer, I'm here because you have a bowel obstruction, so I have an order to place a nasogastric or NG tube in through your nose that'll go into your stomach. And what the purpose of that tube is to help allow that, hopefully that bowel obstruction will heal on its own through the use of the NG tube. So before inserting that, if my patient was on oxygen, I would make sure for the procedure I would either put the nasal cannula in the alternate nostril, so they're still getting enough oxygen. I would have a continuous pulse oximetry probe on so I can monitor throughout the procedure, or a simple mask might be helpful as well. So Jennifer, I just want to ask you a couple questions. First is, do you have a deviated septum? And she says no, she does not. Have you had any trauma to your nose at all before? She says no, she has not. Okay, very good. So Jennifer, I'm just going to go ahead and lay this Chuck's pad underneath you. This is just in case any stomach contents aspirate back. I also will place my patient in a high Fowler's position for this procedure. Just going to wash my hands, and I will use, I already assessed her gag reflex beforehand, and I know that she is able to swallow, and I also know that she is able to follow commands. She knows what to do during this procedure. So Jennifer, I just want to kind of take a look. I'm going to hyperextend your neck here so I can visualize your nostrils to see which one to go in through. Okay, and I'm not noting any obstructions. I can also have the patient alternate breathing through each nostril by occluding the opposite nostril, and she would tell me which one she's able to breathe better through. I see the left nostril has the greatest airflow, so I will use that nostril for the insertion. Okay, I am going to put some gloves on. And what I want to do is I just want to kind of grab my NG tube, and I want to measure from my patient's nose to their ear and then down to their xiphoid process. And I'm getting about 50 centimeters. I can also compare that to my measuring tape, and that matches at 50 centimeters. So my tube, it happens to have nice markings here, and it's hitting the 50 mark, but you can also add a piece of tape so you know for when to stop inserting. Okay. And I'm going to connect my syringe in case there's any aspiration of stomach contents. I also applied a safety pin with a piece of tape to attach it to her gown once it's inserted. And I'm going to open my lubricant. I will lubricate my tube. And you can have your patient hold on to a cup of water if they're able to swallow, if they want to drink and swallow to assist with the insertion. Okay, so I'm going to follow the natural curve of the tube. All right, Jennifer, I'm going to start inserting the tube. And I'm following the natural curve, going in through the nostril, back through the nasal pharynx, following the nasal floor. We have her hyperextend her neck, and she's able to do that for me. And once I reach the oral pharynx, or maybe my patient starts to cough, that's when I will have them tilt their chin to their chest. So she's tilting it for me. And at this point, I'm going to have her drink her water or assist in swallowing. And as she's swallowing, I'm going to gently insert 5 to 10 centimeters with each swallow. Keep swallowing, Jennifer. Keep swallowing. You're doing great. Okay, I reached my 50 mark. So I'm going to grab my piece of tape. I guess I forgot my alcohol prep for securement, so I will hold my tube and I will not let go. While that's drying, I will just verbalize if for some reason as you're advancing it, you're hit and restrict, you're not being able to advance it any further. Withdraw slowly, visualize through the mouth. Maybe your tube is recoiling in the back of the mouth and you may need to retract it. It's also important to assess your patient, make sure that they're not experiencing any respiratory distress. So kind of loop around. Once you have that secured in place, you can let go of your tube, assess your patient, make sure she's doing okay, assess her respiratory status, make sure she's not having any difficulty breathing. Another important thing to note is do not instill any medication or attach it to suction before having confirmation through a chest x-ray. So Jennifer, I'm going to go ahead and send you down to a chest x-ray so we can confirm placement of that tube. And so when she gets back from her x-ray and confirmation is confirmed of the placement, I can attach to suction. Another way to confirm placement is to aspirate back the stomach contents and visualize the characteristics. You may have some litmus papers to test for the pH. The pH should be 5.5 or less, letting you know that it's in the stomach. It should be more acidic. So I'm going to disconnect my syringe here. Go ahead and attach it to her gown. Okay, and that should be suctioning okay. I will clean up my supplies, throw things away. I'm going to wash my hands. And I would ensure safety, make sure my client has her call light, bed is in the low position. And I would also make sure to document the type of NG tube used, the size of the tube, how the patient tolerated it, any assessment findings, maybe some, if you aspirated some gastric contents, maybe the color, the amount. And some lifespan variations is maybe you have an elderly client that may be confused at times, maybe has a tendency of pulling at lines. You might want to place a bridle, which is a securement device on their nose that keeps it in place. Or with pediatric clients, you want to make sure you have the appropriate size, the French size of the nasogastric tube. And I think that concludes my video. Thank you.